in the process of public participation.
Right.
And I would want to convince you why we really need the quality of healthcare and patient safety bill.
Right.
2025. When the government came into power, Kenya Kwanza government, the first thing that we did was to come up with acts that are aligned to facilities, you know, professionals, but we forgot the patient.
Okay.
You know, we forgot the patient. And that is why it is very, very important to ensure that we establish a comprehensive legal framework to enforce standards on quality of healthcare across all sectors, whether private, public, or faith-based. The way we treat our patients, it should be standard, and it should be entrenched in the law. Many a times is when I look into the media and I feel so sad when patients have to record themselves and send videos, you know, so that they can get justice. It shouldn't be like so.
Right.
It should automatically be, there is a legal framework that tells you if you're mistreated in a facility, this is where you report.
Okay.
And this is what will happen. Then the second one, we want to establish a national authority that is going to regulate the quality standards, monitor compliance on those facilities, so that if we know facility X is mistreating patients, then we have the authority to go and reinspect or even revoke their licenses.
Okay.
And we also have that authority that will accredit the license, they'll inspect, and they will also be able to rate the health facilities. We will be having maybe 5-star facilities, you know, depending on the rating that you have been given, just like hotels, the way they do it. Then the other thing is the standardization and accreditation. We have our KMPDC that has been licensing and accrediting at the same time. Now, you are a doctor, all right? You have a facility. And there's this institution that licenses you, accredits you, and does everything. There's conflict of interest, of course. So we want to separate that and ensure that there's uniformity in the way accreditation is done, and there's national quality standards for registration, for licensing, for accreditation, for inspection, and categorization of facilities. We have seen facilities that are level 2 operating like level 4.
Yeah.
And those are the ones that make patients die on the patient's bed.
Until then, Madam PS.
Yes.
Because I'll find myself calling you CS so many times, and I'm telling you should be saying amen to that. Something must surely be happening, because until the bill is passed and assented to law, we still are having these concerns that we're talking about. Hence my question on how best we can ensure that there's safety in hospitals, both for the workers and the patients. The question of compliance still becomes a problem, like we rightfully admit that, you know, you'll have a level 2 hospital that is acting like it's a level 4. Hence, we, you know, the reasons why we have some of these problems. We still have queries on the question of compliance, especially with public standards and professionalism. And of course, on the question of the health workers, you know, most of the fingers are pointed to them, because then we get to see these problems. Until the bill, you know, is successful and assented to law, what is happening?
You see, it's not that we are not doing something. There are already institutions that are mandated to do that.
Right.
And I'll keep mentioning our KMPDC, the Kenya Medical Dentist and Practitioners Council, which is mandated to inspect, accredit. But we have realized there could be conflict of interest in the process, and that is what we want to solve.